Welcome to the Boulder County Breastfeeding Coalition training on how to create a breastfeeding-friendly child care setting. The purpose of this training is to help you create a breastfeeding-friendly environment that promotes and normalizes breastfeeding in your child care setting. Please be aware this is a pre-recorded module. If you have questions, please contact us using the links provided on the indicated slide. The objectives of this training are to attain knowledge about the importance of breastfeeding, the characteristics of breast milk, the storage and handling of breast milk, understanding the behaviors of the breastfed baby, paced bottle feeding, and what it means to be breastfeeding friendly, as well as understanding the resources available to you. In this section, we would like you to consider the following questions and reflect on how you feel about breastfeeding. There is no right or wrong answer. Agree or disagree? Breastfed babies are healthier. Agree or disagree? I'm comfortable handling breast milk. Agree or disagree? Formula is just as good as breast milk. Agree or disagree? Supporting breastfeeding families is a part of my job. Agree or disagree? I can have an impact on how parents feed their children under my care. Agree or disagree? If I had another baby, I would probably breastfeed. Agree or disagree? Breastfeeding should be done in private. Agree or disagree? Talking about breastfeeding makes some moms feel guilty. In this section, we will talk about the importance of breast milk. Why is breast milk important? So, why is breastfeeding important? Breastfeeding is important because it helps keep healthier moms and babies. It also helps reduce the risk of diabetes, leukemia, ear infections, gastrointestinal infections, asthma and allergies, sudden infant death syndrome, and childhood obesity. There are also studies that show that breastfed babies have higher IQs. In addition to the vast benefits that babies obtain from breastfeeding, moms also benefit. Moms return to their pre-pregnancy weight more quickly, but it's not just about losing weight. Moms' bodies heal faster when they breastfeed. The uterus is a muscle that is stretched out during pregnancy. Breastfeeding releases hormones that help the uterus contract back to its pre-pregnancy shape and size. The contractions that moms feel are like intense menstrual-like cramps in the days after delivery. Even though they may be uncomfortable, this cramping is helping the body heal and reduce postpartum blood loss. For every year that a mom breastfeeds, she reduces her risk of any type of cancers that most often affect women, like breast and ovarian cancer. Breastfeeding is recommended for at least 12 months. The World Health Organization recommends it for 2 years or more. Breastfeeding also helps create a close bond between mom and baby, as well as a nurturing relationship. In addition to the many benefits for mom and baby, breastfeeding also provides benefits for the child care setting. For example, breastfed babies get sick less often. Breastfed babies spit up less often. And breastfed babies' diapers are less smelly. In addition to the many benefits of breastfeeding also saves money. Did you know that breastfeeding can help a family save up to $1,500 a year? It also helps our community because since breastfed babies are sick less often, parents take fewer sick days from work. This helps businesses be productive and have lower healthcare costs. In this section, we will learn about the handling and storage of breast milk. It is important to take into consideration the many valuable characteristics of breast milk in order to understand the care that should be given to handling breast milk. Breast milk is the best food for babies. Each drop contains thousands of live and active cells. Take a look at the images on the screen. The image on the left is an image of a drop of formula under a microscope. The image on the right is the image of a drop of breast milk under a microscope. Observe the huge differences between both. Breast milk is a live product. Formula companies study breast milk to replicate the components and benefits of breast milk. It is impossible, however, to completely duplicate a live product that is responsive to babies' needs. Moms don't need to follow a special diet while breastfeeding. Culturally, there are foods that anecdotally help increase milk production, but in general, most foods consumed in moderation are compatible with breastfeeding. There are very specific cases in which allergies or sensitivities that result in certain foods needing to be eliminated or limited from mom's diet, but these are not very common. Our bodies have the ability to produce the perfect food for our babies, even if the diet isn't perfect. When handling breast milk, it is important to understand that breast milk is not considered a biohazardous material. It is food. It is not necessary to wear gloves while handling breast milk. Refrigerate milk as soon as it is brought to the child care setting. Refrigerate fresh or thawed milk and store it in the back of the refrigerator or freezer. Make sure that the bottle or container is clearly labeled with the baby's full name, time, and date that it was expressed. Freshly expressed breast milk can be left at room temperature for up to 6 to 8 hours, in the freezer compartment of a mini fridge for 2 weeks, in a standard upright 2-door refrigerator for 5 days, in the freezer compartment of a standard refrigerator for 3 to 6 months, and in a chest freezer for 6 to 12 months. Breast milk looks different than formula. For example, breast milk looks more watery than formula and can separate. It may also have a bluish tint. Breast milk is constantly changing to adapt to baby's needs. Because of this, you may notice changes in color and consistency, even in milk expressed in the same 24-hour period. When milk separates, it does not mean it has spoiled. Later, we'll talk about how to reincorporate the fat that separates. Avoid waste by asking moms to bring small portions, 2 to 4 ounces of breast milk per portion at the most. Offer 1 to 3 ounces at a time and evaluate if baby will need more. If baby wants more, offer 1 ounce at a time after offering the first portion to avoid waste, since once baby has taken from the bottle and doesn't finish it within an hour, that milk must be thrown away. Once milk has been thawed, it must be used within 24 hours. Colostrum or liquid gold is the very first milk a woman produces the first few days after delivery. It is extremely valuable for baby. Sometimes it can have a yellow, reddish, or even green tint. It also has a sticky consistency. Colostrum is concentrated milk and should never be wasted. Never heat breast milk on the stovetop or in the microwave. Heating breast milk in the microwave can create hot spots that can burn baby's mouth. High temperatures can also destroy beneficial nutrients in breast milk. Breast milk should always be thawed in the refrigerator or in a bowl under lukewarm running water. To reincorporate fat in breast milk, gently swirl it. Do not shake. Shaking it has a potential to destroy protein structures in breast milk. Never refreeze thawed milk. In this section, we will learn about bottle feeding techniques. Have you ever considered what size a newborn baby's stomach is? Look at the picture on this slide. The size of a 1-day-old baby's stomach is the size of a cherry. Of a 3-day-old, the size of a walnut. Of a 1-week-old baby, the size of an apricot. And of a 1-month-old baby, the size of an egg. Pretty amazing, right? Take this into consideration when bottle feeding a baby. Breastfed babies may eat more frequently than formula-fed babies. This is because breast milk is easily digested. Breastfed babies tend to take smaller portions per feeding and feed more frequently. This also helps avoid wasting. Babies that nurse from the breast take small pauses. This is because nursing from the breast requires more effort than drinking from a bottle. Therefore, when offering a bottle, implement paced bottle feeding and use slow flow nipples. Breastfed babies should be fed on demand and not according to a schedule. Let's talk about hunger cues. During early hunger cues, babies may start stirring, opening their mouth, seeking for the breast, or rooting. Babies should be fed during early hunger cues. During mid-hunger cues, babies' signs of being hungry are a little more obvious. Babies may stretch and really start stirring and sucking on hands. Don't put the feeding off because it's very likely baby will start crying soon. Look at the baby in these pictures. She looks pretty upset, right? Her previous hunger cues were ignored. Now she is crying, displaying agitated body movements, and turning red. It's harder to feed a baby that is this upset. It is necessary to first calm and then feed the baby. This is why we must honor early hunger cues. In this section, we will learn what it means to be breastfeeding friendly. Being breastfeeding friendly means that the child care setting has a written policy that supports breastfeeding. Employees are trained in the benefits of breastfeeding, paced bottle feeding techniques, and the handling and storage of breast milk. It promotes breastfeeding throughout the facility for families and employees, and it provides evidence-based material available to parents that is not provided by a formula company. In order to be breastfeeding friendly, it is necessary to do a self-evaluation. The child care setting should have a written policy that demonstrates their commitment to breastfeeding. This policy should be communicated to all employees. There are sample policies available on the Colorado Breastfeeding Coalition website. In a breastfeeding-friendly setting, employees have training on the benefits of breastfeeding, storage and handling of breast milk, and feeding techniques of a breastfed baby. Employees also show a positive attitude towards babies that are breastfed and feed babies on demand and not on a schedule. A breastfeeding-friendly child care setting supports moms and employees to be able to breastfeed or pump throughout the day. The center displays posters, images, or materials that promote and normalize breastfeeding. There are toys, books, or materials available to play and learn about breastfeeding. A breastfeeding-friendly child care setting provides evidence-based materials to parents. It is possible that parents may not know who to contact with questions about breastfeeding or pumping. It is important to have printed materials available with information about local resources, not materials provided by formula companies. As a child care provider, you have an extremely important role. Not only do you care for and help educate babies every day, you are also a valuable resource to families with babies under your care. Parents trust you. By showing a positive attitude towards breastfed babies under your care, you can help support families on their way to a healthier life. If you have any questions about this training, please contact any of the people listed on the screen for more information, or your local public health agency or local WIC office. Thank you for participating.